in the Black community said for every Black woman who reports rape, at least 15 Black women do not report, and 1 in 4 Black girls will be sexually assaulted or abused before the age of 18. Switching topics just a little bit. Again, April is Sexual Assault Awareness Month. I'm a father of 2 girls. I'm a girl dad, and so this really rings home as far as sexual assault and trauma in Black women. Dr. Magdala, can you briefly shed some light on the plight of Black women as it pertains to sexual assault in the Black community, especially as it pertains to our women and girls in the community?
Yeah, absolutely. So I think this is an important topic, and so we have to look at it 2 ways. One, it's, are we even able to have these topics at the community level? And I think we all can agree that quite often sexual assault, whether it's rape, molestation at whatever degree, we don't talk about. And we kind of keep them in silos and keep it taboo. And not only don't we talk about it, when it comes to reporting, a lot of times those from minority communities do not report. And some of that lack of reporting is, one, you feeling like you're not going to get believed and that someone's going to actually say it was your fault. 2, quite often the person who's been assaulted has been assaulted. The attacker was a person they knew, whether it's a friend or a family member. So now there's more complications to speaking up, where now you're actually going to be known by your family, like, why'd you do that? We're supposed to keep everything private, keep it in-house. And then the stigma that follows, where people don't want to be labeled thereafter. So there's a whole slew of statistics and numbers that show the disparities between us actually reporting these attacks when they happen to us and what happens after. And then even more so when people do report them, convictions, right? So what happens later on, especially if the attacker is a person of a different color. And that's we can go into the whole gamut of racism and what that looks like from there. So I think the reason why this is significant is we don't often talk about this with our doctor. I know for me, even as a person who practiced adult medicine and internal medicine, so that means I was seeing people 17 and up, I am because I'm familiar with symptoms of those who've been assaulted, the body language that may happen, especially as you're doing an exam, I would clue in into those clues to ask those questions, but it's not really part of our protocol to actually put that, document that, or even have that conversation. And that's important because the level of risk you have when you've been assaulted to substance abuse, which is relying on alcohol, drugs to kind of mediate your emotions, panic attacks, anxiety, eating disorders, chronic diseases that are really because you've been marinating on something that happened to you, but you can't tell no one, you can't talk about it. So now what looks like obesity isn't really obesity, it's really depression, and you feeling alone and not being able to tell somebody what happened to you, or you told someone and no one believed you and you've been outcast. So it really does play a part into someone's health. And unless we start having these conversations both in the community to label what is not appropriate and what is appropriate, and then start talking about, if it has happened to you, what are the complications that may happen, and here are the things you need to do about it, whether it's seeking mental health, making sure you talk to a primary care provider that you're comfortable with, where you can be honest about these events, and what the effects of it. We will be in a really tough place in regards to talking about this. And my last point is going to be, this is really important now because domestic violence and domestic abuse went up tremendously in the pandemic, because a lot of people were using school and work as their way to get away from home or away from the person who was doing these attacks. And that led to a really high increase in suicide rates. So I know this is the month where we're talking about it, so it's the topic of the month, but it actually is pretty significant to be talking about this now, when a lot of people have been really experiencing more sexual assault, domestic violence at home because they've been home and quarantining in place. So again, another reason why this conversation needs to continue and needs to happen in places like these.